there's definitely been some changes I've seen over the many years of epilepsy and attending these meetings. So one of the things that's really changed is our opportunities to use devices and other surgical techniques for epilepsy. So the meetings used to be very much about which is the latest medication, and we still have 2 new approved medications we're very excited about, but now we also have other alternative treatment strategies. So with devices, we're talking about things such as neuromodulation and changing the pacemaker rhythm of the epilepsy and reducing seizure burden. And then we continue to also use surgery to resect the seizure focus, but we again have new technology such as laser. So we're not working with just the traditional ways for surgery, and we also have new ways of implanting the electrodes to map out the seizure focus and really looking at epilepsy as a network disease rather than just one single isolated focus. And I feel like through these new strategies we're able to offer treatments to so many more patients that really were not eligible for treatments before that could really make a difference in their epilepsy. Another area that I think that really I've seen change over the years is a focus on the entire spectrum of epilepsy care. So it's not just about treating the seizures, but it's more so about treating the whole patient. And so we have a lot of emphasis on the comorbidities that occur with epilepsy, whether it's higher rates of depression, anxiety, lower quality of life, and really also bringing in collaboration across the professional spectrum from the APPs, such as nurse practitioners, all the way up through the neurosurgeons, as I mentioned, but also from pharmacy, from psychiatry, psychology, social work, et cetera. And so the idea that epilepsy is much more than treating the seizures, and it takes a whole team of professionals to provide the best treatments possible. In particular, we have made a lot of progress in engaging, for instance, the advanced practice practitioners through really a lot of effort of some leadership on the board that really spoke up and thought about what would be helpful to engage them in the meeting. But the other thing is the delivery of healthcare is changing. So many of us, as part of our epilepsy program, we have physician assistants embedded within our epilepsy program, which wasn't the case 20 years ago. So this session in particular that emphasized interprofessional care, yesterday was a really great session, but yet the downside of that is that the room was overflowing and not everyone could get into the room that wanted to hear the session. So we're sort of struggling with the downside of our success, but it's a great problem to have. One of the reasons why I chose to focus the Presidential Symposium on management of women with epilepsy during childbearing years is I feel like there has been tremendous progress over the past 15 years. So we actually have data that's very sound that provides the tools for us to practice evidence-based medicine. However, there's a lot more work that needs to be done. The medications that we have good information on are really very small handful compared to all the medications that are being prescribed. So that's one area that we need to continue to promote, such as the pregnancy registries to get more information, but then there's other types of studies, such as those looking at long-term neurodevelopmental consequences to the children that were exposed to the medications in utero. So we really need to continue that work. On the flip side of that is you can see by the prescribing patterns that there is an increased awareness that some medications are much safer than others. So the medicines that are less safe, you see the number of prescriptions written for those medications going down over the years. But there's still a lot of practitioners out there and patients out there who are not aware of the information we have, and we need to continue to increase that awareness so that a woman goes into a pregnancy with the best chance for her health outcomes and the long-term health outcomes of her child. We certainly have reached out to other communities, and we certainly hope to and continue to try. In my personal practice, I'm incredibly fortunate to have colleagues in the other areas, especially contraceptive gynecology, which is an important piece of this, to be able to have planned pregnancies, and then through obstetrics and maternal fetal medicine specialists, through the neonatologists who are taking care of the children. So I'm very fortunate, but also realize that is not the case in a lot of other settings, including obviously in the US, never mind worldwide. So we did recently release, it's in publication in print, recommendations from the International League Against Epilepsy Task Force on Treatment of Women with Epilepsy during pregnancy. And we put it in a format that's open access in an educational journal. That is, the idea is that it will be available to a nurse somewhere, a primary care doctor, really across the wide spectrum. And then also there will be a patient piece that will be come out of this very soon and will be available on Wikipedia. So the public access is a big part of the puzzle as well.